Hi, my name is Jennifer Quigley. I am the medical esthetician here at Cynthia Gregg Face and Body Specialist. Thank you for joining our Patient Appreciation Day. Today, I'm going to dispel myths and misconceptions about medical skincare. So let's jump right into myth number one. Aren't all skincare products made the same? Well, actually, no, they're not. Skincare products are much more sophisticated these days in general. However, medical grade skincare products are always going to be a complete category of their own due to the percentage and the type of ingredients in these products. They're always going to be a higher quality. They are going to be able to penetrate and be more efficient in lower layers of the skin, whereas FDA through regulations will simply not allow an over-the-counter product to do any of those types of things. So your over-the-counter products are typically going to have more filler, possibly a little more fragrance, and they're always going to sit on the top layer of the skin. So even though we may hear nice ingredients like vitamin C and hyaluronic acid within the arena of over-the-counter products, they are nowhere near the type of ingredient, the quality, or percentage that is going to be contained in a medical grade product. So when I'm curating a skincare routine for a patient at home, I absolutely lean on all of my medical grade skincare products because they are without a doubt going to deliver results typically before I even touch a patient with a modality or treatment within the office. Myth number two, Retin-A thins the skin. And this is going to be another no. Retin-A actually will thin the upper layers of your epidermis, but it's going to thicken the lower layers within your dermis. And the main reason we want that is most of our damage is going to be in those upper layers of epidermis. So we want those to be exfoliated because over time, we're no longer exfoliating like we did in our 20s and 30s. So a Retin-A or retinol medical grade product is going to help increase and facilitate more exfoliation on a consistent basis to improve our aging process, our texture, the pigmentation we may have in our skin. So that is not thinning the upper layer, it is exfoliating. Now what it's going to do deeper is as we age, we are losing hyaluronic acid, collagen, elastin in our dermis. So we want to keep that nice and plump and healthy, and vitamin A assists with that as well. You should be able to use a proper retinol or Retin-A product more nights out of the week than not after several weeks of introduction. Otherwise, if you maintain a month or two into using a retinol product, an angry skin, red, still really peeling and irritated, your product is too strong. Always consult with a clinician when picking out a medical grade retinol. Myth number three, eye creams aren't necessary. This is a biggie in my world. Most of the patients that come in here may at one point in their life either consult with Dr. Gregg or have thought about consulting about their eye area. Yet, when I ask if they are taking care of that area, the answer is typically no. Since medical grade products work at a deeper level and they contain a higher, more effective ingredient index, it only makes sense that we treat and protect and correct the eye area just as we would the rest of our face. I think this has become a myth because over-the-counter products, being they sit on top of the skin, really don't do much in the lower layers of the eye area. So when picking out a skincare routine for patients at home, I promise you an eye cream will always be part of it because it's going to help plump, hydrate, and start to correct that eye area should you want to have any other types of treatments within the office to improve that area. Myth number 4, I had a peel and I did not peel, so it didn't work. And this is definitely a myth. One thing I'd like to stress is, in the 20 years I've been doing this, peels have gotten much more sophisticated, just as skincare has. And what I mean by that is, you don't need a peel that is completely going to take off your skin anymore. That is why we have lasers and deeper treatments. When we're talking about a peel, though, that we have outlined together that will induce some peeling, not all people are going to peel equally. The more a person has prepped their skin at home with vitamin C's and retinol products, exfoliating products, certainly all medical, then you may not have as much dead cells to push out. That does not mean that the peel did not penetrate into the lower layers of the epidermis and upper dermis to create a wonderful cascade reaction to anti-aging that skin by stimulating collagen and exfoliating dead cells. We're losing cells all the time. They come off and we sometimes don't even see it. We do not always have to see a heavy flaking, peeling situation in order for us to feel like the peel did take place. Most peels, when they are to induce a peeling effect, do indeed create some peeling on the skin, but how much that skin will peel depends also on how many peels you may have had in the series. Sometimes patients will have their first deeper peel and peel the most with that peel, and maybe their second and third in that series, they peel a little less each time. I have also seen peel number 1 not peel as much, peel number 2 a little more, and peel number 3, they peel the most. It really does depend on genetics, a person's skin type, how much damage they have, again, how they've prepped the skin and taken care of it leading up to receiving the peel. But just because you do not have strong or heavy peeling does not mean that peel was not effective. Myth number 5. I had a microneedling treatment or a photofacial treatment singly or a series in the past and it didn't work. I hear this quite a bit most of the time in consultations. I do teach my patients maintenance is always going to be required with any treatment. And it takes more than one treatment to turn back decades of damage. So when a patient says to me, I had some IPL in the past for the reds and browns, but I don't think it worked, what I typically can uncover is it worked for a couple years. They did not maintain with any sort of skincare products at home or in-office light superficial exfoliations, and they certainly were not told that maintenance treatments would be a very good idea to have long-term success. I make sure when I consult patients and we discuss any aggressive treatment plan, whether it be laser resurfacing, or microneedling, that there will be maintenance once our series has finished. Because we don't live in a bubble, and when we go outside, we may accumulate more damage, or the damage that we previously had does have a memory. Cells have memory. So pigment can come back. Those capillary walls, they're thinning every day. So as long as we stay on top of that, which means I typically will treat 1 to 2 times a year, depending on the patient's lifestyle and how much exposure they've had after their initial series. And microneedling, or something that's inducing collagen, we are definitely going to treat quarterly. After about the age of 40, we are no longer producing collagen. So Once I get collagen going in a series, I want to keep that well full. I don't want to wait until the collagen has diminished again and then restart. So typically I recommend one microneedling session about every 3 to 4 months. Again, depending on lifestyle and the treatment plan we have outlined. This will ensure longevity and give my patients nothing but better and better results. Thank you so much for joining me during this presentation today. Please be sure to watch all of our provider presentations throughout the day as they dispel myths and misconceptions in aesthetics. Also, if you'd like to make a consultation with any one of our providers, please call the office and go ahead and start your skincare journey now. We look forward to seeing you very soon.